Hi, this is Dr. Centeno, and today I'd like to talk to you about why I trust our Regenexx Network physicians. Now listen, I'm a type A personality. I absolutely positively don't give my trust easily. And so this is an important thing for me to discuss. When we began offering stem cell treatments in 2005, there was really no one else doing this kind of work. Today there are lots of different choices, lots of people putting up signs saying that they do stem cells. We've even seen doctors putting up stem cell billboards. Now, since we began constructing our network of Regenexx providers in 2011, we've been approached by about 1,000 physicians who wanted to join. Yet to date, we've only accepted less than 50 of those applications. Why is that? The big issue with teaching a technique that's very dependent on physician skill is that oftentimes it's like a copy of a copy of a copy. If you remember old Xerox copies and copies that were copied and copied, they didn't look an awful lot like the original. And that's the problem with Regenexx. It's so dependent on physician skill that unless we get the right doctors involved doing it, we're never going to be able to replicate it around the country. And this happens frequently in medical technology. Once medical technology gets out there, the folks that created it do very well with it, and then everyone else learns it, and they learn it in kind of a copy way, and it fails. And since we're tracking outcomes, we can't have that happen. And that's what's happening right now with the stem cell Wild West. We have patients getting injected with what I call baby P amniotic fluid containing no live cells, being told they're getting a stem cell injection. We have physicians injecting toxic substances with live cells that will kill or hurt the cells. We have doctors performing blind injections into joints who can't document that they got into the joint. We have physicians drawing stem cells from only one site and reducing that stem cell number when they should be drawing from multiple sites. We have surgeons sprinkling stem cell magic pixie dust into their surgeries that we know don't work. So to avoid the copy of the copy of the copy syndrome, we needed to enforce strict standards on who could join our provider network. That included basic training in imaging-guided injections, extensive experience in training and treating musculoskeletal injuries, mandatory training and testing in core competencies, and hands-on cadaver-based training to demonstrate to me that they could do this specific procedure. And with Regenexx, it's not just one procedure or two procedures or three procedures. It's almost 100 different procedures in all the different body areas. So extremely technique dependent. So in summary, the Regenexx Network is an elite group of hand-picked doctors who I personally train. These providers have much better qualifications than the average doctor performing these procedures, and that's why we've turned away hundreds of physicians. So if we don't have one in your neighborhood or your area, we're always trying to work that map and trying to get it more filled out, but we have to find the right doctor to do that. We're not going to take just anybody. So thanks so much for watching, and thanks for allowing me to explain why this is so important to me to have a great network of elite, highly skilled physicians.